We have partnered with Dignity Health to provide information about colon cancer over the next few weeks, as I mentioned earlier. And our goal is to increase awareness and the importance of screening and understanding your treatment options. And with me today is Dr.
Najafian,
who is a rectal cancer doctor, and also the director of, I want to make sure I get this right, of the Colorectal Center at St. Joseph's Westgate Medical Center. Did I get that?
Kind of. Well, I'm a director of the Robotic Center of Excellence, which we've created over the last few years. We've built this program, and that's what I'm here to talk about. Westgate, which is the only program in town, actually, that has a whole ecosystem, service line program, a team approach of physicians, nurses, and all supporting staff, as well as administration support, to help patients go through the system for colorectal issues. It could be cancer, it could be diverticulitis. It's the only one like it in town, and honestly, it's the best program I've been involved with.
Yeah, and what's very important, we were talking before you came on, we got to get the word out to younger people.
Yeah.
And that's why this center is so important, because you guys talk in layman terms to them so they can understand this and understand what's going on. And we're seeing it more in young people. Why is that?
You know, we're still not sure. There is some clues. You know, about 150 to 160,000 people a year get diagnosed with colorectal cancer. Out of that 150 to 160, 18,000 of them are under the age of 50. So about 12% of all colon cancers are diagnosed under the age of 50. When I first started my practice in 2007, I would see maybe 1 or 2 patients a year that were in their 30s and 40s. Now we see it very regularly on a monthly basis, which is very, very unusual.
Wow. Let's switch gears and let's talk about treatment options, because that's something that everybody wonders about. Okay, they've been diagnosed, they're going to go through the treatments and stuff. What are they going to expect when they go through all this?
That's a very fortunate thing. Over the years, we've gotten much better at treating colon cancer. It used to be done in an open fashion, which patients would be in the hospital for a week or longer. Then it was laparoscopic. Now robotic surgery has really taken off, and actually a lot of colorectal surgeons provide that service in the Valley. But I think what makes Westgate St. Joe's different is that there's the ecosystem, that there's a group of people that help with the robotic surgery as well as the surgeon itself. I train a lot of surgeons around the country as far as robotic surgery, and one of the biggest things that I try to stress on the surgeons is building a program like we have at Westgate, where you can actually have the whole group of staff that supports the patient through their journey through the hospital course.
Yeah.
And you know, our patients give us great reports. Our reviews are always 90-95 percentile as far as how happy they are with the results.
Yeah. Right now we're looking at some surgery here. Can you tell us a little about this here? What's happening?
Yeah, so this was a patient I just operated on a couple of weeks ago, and basically she had an operation done for colon cancer that was done on a Friday. The surgery took about 2 hours, 2.5 hours to complete from beginning to end, and she was in the hospital for 2 days. So she was done on Friday. She left on Sunday, and she's doing great.
Wow, that's quick. That's like a very quick. And what's so interesting is that I will say probably, I'm going to say almost 10 years ago, I met some doctors that were starting to use robotics, and they said, well, this is never going to happen. You know, we need to have the doctors right there for it and everything like this. But now we're seeing that it's possible where you can have the top physicians like you here, but working on somewhere else and making it things better.
I think that's ultimately at some point that could happen, where you have a physician at one place, a surgeon at one place, and having the patient completely different place. I think we're not ready for that yet. Patients want to have their surgeon in the room, but I think that is ultimately the goal. You can't have, there's 7 billion people in this world and growing, and you can't provide great care to all these people, and robotics will probably be a part of that.
Yeah, very important, playing a big part in assisting us in our health and everything. So it's amazing. One thing you like people to start doing, if you know they are starting to take a look at Dignity Health and looking at their bodies with cancer and everything, what tip do you give people to do?
Preventative, preventative, preventative. Get your colonoscopies. If you have rectal bleeding, I don't care if you're 20 years old, 30 years old, pay attention to that. That is not something to just let it go. We're seeing a lot younger patients. Get a colonoscopy done. You know, there's a lot of other tests that are out there that are better than nothing, but I think the gold standard is still colonoscopy, and that could potentially cure you from getting colon cancer.
Well, I'm looking forward to having more of these talks, doctor, and to get the word out to people and stuff. Tell them where they can find out more about, of course, you and the Dignity team.
You know, I think you'll have the website on on the screen, so you can get on there. There's a phone number you can call, and they can direct you to a colorectal surgeon that could help you, who does a lot of these cases.
All right, yeah, and we'll also have it on aztv.com for you to find out more. So,
thank you,
doctor. Thank you very much.
Thank you very much.
Thank
Appreciate it for having me.
All right, we got more Mix coming up right after this.